Question number 61. A patient visits the clinic for the first time in order to perform an accurate and complete assessment. So which of the following would be the nurse's first step? Option A, obtain a complete history. Option B, obtain a blood pressure. Option C, perform a review of systems. And option D, obtain a temperature, pulse and respiration. So in order to perform the first time assessment of the patient, so first step will be to obtain a complete history. So option A is correct answer. Question number 62. During nursing assessment, the nurse documents the presence of skin breaks, abrasion, blisters or shallow crater, edema and infection. So according to recognized staging system, which is the classification of this pressure ulcer? Option A, stage 1, option B, stage 2, option C, stage 3 and option D, stage 4. So option B, stage 2 is correct answer, because as you know, in case of the stage 1 pressure ulcer, skin is intact with the presence of some redness, and in case of the stage 2 shallow open ulcer, blister or abrasion is there. In stage 3, skin loss extend to the subcutaneous fat and forming a crater, but bone, tendon or muscles are not visible. Or in case your stage 4, deep tissue damage exposing the muscle, bone and tendon. Question number 63. The major role in maintaining the fluid balance in the body is performed by which of the following organ? Option A, liver. Option B, heart. Option C, lungs, and option D, kidneys. So option D, kidney is correct answer, because fluid balance in the body is maintained by the complex organ system such as your kidneys, brain, adrenal gland. However, kidney is main central regulator which filtrates the blood and adjusting the urine output and to excrete the excess water, waste or conserve the fluid and managing the salt and mineral salts. Question number 64. What is the term used for high-pitched musical sound in the patient during a respiratory assessment? So option A, crowning, option B, wheezing, option C, crackle sound, and option D, Korsakoff sound. So option B, wheezing sound is correct answer, because wheezing sound is a high-pitched whistling noise during the breathing, usually from the narrowed or obstructed airway, most commonly during the exhalation. Or in case of a Korsakoff sound are the specific heart with the stethoscope during blood pressure assessment. Or in case of your crackle sound or rail sound are the short popping or bubbling sound in the lungs. Question number 65. A patient wound is draining thick yellow material. So the nurse correctly described the draining as which of the following? Option A, serous, option B, purulent, option C, sanguineous, and option D, serous sanguineous. So option B, purulent is correct answer, because serous a clear, thin and watery fluid, and sanguineous is a bright red and which may be the thick, and purulent is your thick, opaque, usually yellow, brown, green or grey sometimes. Question number 66. Air that develop in the pleural space is referred to as which of the following? Option A, atelectasis, option B, hemothorax, option C, pneumothorax, and option D, pleural effusion. So the pneumothorax is the presence of the air or gas in the cavity between the lungs and the chest. So option C, pneumothorax is correct answer. Whereas atelectasis is the collapse of the lungs or the part of the lungs. Or in case of your hemothorax, where the blood collects in the pleural space between the lungs and the chest wall. Or in pleural effusion is a buildup of the excess fluid in the pleural space. Question number 67. What does the difference between apical and radial pulse rates define as? So option A, pulse deficit, option B, pulse pressure, option C, pulse amplitude, and option D, heart arrhythmia. So option A, pulse deficit is correct answer, because pulse deficient is when the heart rate is faster than the pulse felt at the peripheral artery like the wrist. Question number 68. A 68-year-old man is admitted to the medical ward with the diagnosis of congestive heart failure. Upon auscultating the patient lungs, so the nurse hears the crackling sound bilaterally at the base. So which term should the nurse use in documenting this finding? Option A, rail, option B, bronchi, option C, wheezing, and option D, atelectasis. So option A, rails is the correct answer, because rails now commonly called crackles, and which is a continuous rattling, bubbling or crackling lung sound. which usually present in your congestive heart failure. Question number 69. Where should the nurse write the measure and criteria to achieve the desired outcome? Option A, planning. Option B, evaluation. Option C, assessment. And option D, nursing diagnosis. So option A, planning is correct answer. Question number 70. 5 days after abdominal laparotomy for a 34-year-old patient. So the nurse finds that the patient is febrile and notices swelling and edema around the wound and few purulent discharge from the wound. So what those signs indicate? Option A, septicemia. Option B, wound infection. Option C, normal healing process. And option D, the wound needs to be reopened for the new suturing. Option B, wound infection is correct answer because the option is septicemia. Septicemia is when bacteria get entered into the bloodstream and form an infection to another part of the body. So other signs of septicemia are your rapid heart rate, confusion, disorientation, lethargy and reduced urination. If I'm talking about option C, normal healing process, so in case of normal healing signs are the decreasing the level of pain, redness, inflammation, new pink tissue growth or mild itching. So that's why option B, wound infection is correct answer. Question number 71. A patient with pneumonia finishes a course of levofloxacin. So which of the following lab result best indicate a desired outcome? Option A, normal white blood cell count. Option B, normal hematocrit count. Option C, normal platelet level. Or option D, normal potassium level. So option A, normal white blood cell count is correct answer because an increase in the white blood cell count called leukocytosis is usually the body response to fighting of infection, inflammation, stress, injury or any severe allergies. So if after giving medication it will see the WBC within the normal range, so it will show the good outcome of the medication. Question number 72. Which of the following nursing intervention is appropriate when an IV infusion infiltrate? Option A, elevate the site. Option B, discontinue the infusion. And option C, attempt to flush the tube. And option D, apply the warm moisture compression. So option B, discontinue the infusion is correct answer because in case of IV infiltration, it will cause further vein damage or even it will cause swelling and coolness. So it required immediate removing of the catheter, and after that even we can elevate the limb and applying the compression. Question number 73. An immobilized patient, 63-year-old patient, is unable to strengthen her arms due to the shortening of the muscle fibers. So which of the following defines the defect of this condition? So option A, contracture. Option B, venous stasis. Option C, disuse atrophy. And option D, disuse osteoporosis. So contracture is correct answer because contracture is a condition of shortening and hardening of the muscles, tendons or other tissue and often leading to restricted joint mobility. Question number 74. Which type of isolation category is indicated for patient with diphtheria? So option A, airborne. Option B, droplet. Option C, contact. And option D, blood. So option B, droplet is correct answer because diphtheria is a serious bacterial infection typically affecting the nose, throat and spread by the respiratory droplet. Question number 75. A patient suffers from diarrhea and muscle weakness. So the nurse would assess this patient for which of the following abnormal lab blood test? So option A, blood calcium. Option B, blood magnesium. Option C, blood potassium. And option D, blood sodium. So option C, blood potassium is correct answer because due to the imbalanced potassium level, further it will cause the muscle weakness, cramps, fatigue, constipation or even heart palpitation. Question number 76. The antidote to heparin is option A, aspirin, option B, vitamin K, option C, warfarin and option D, protamine sulfate. So option D, protamine sulfate is a correct answer. So question number 77. How do we monitor the effectiveness of warfarin? So option A, monitor the vital signs. Option B, PT and INR. Option C, weight. And option D, ask the patient how they feel. So option B is correct answer because the target INR is typically 2.0 to 3.0, which indicate the slower clotting process, while a normal INR without medication is 0.1 to 1.1, meaning blood clot faster. So the PT measured the clotting time in the second, usually 11 to 13.5, and secondly, it will consider it's normal, but prolonged 16 to 20 seconds will consider normal with warfarin. Question number 78, when a physician order an arterial blood gas, so which artery is the appropriate one to use to obtain the specimen? So option A, cerebral artery, option B, radial artery, option C, carotid artery, and option D, ulnar artery. So option B, radial artery is correct answer because we choose the radial artery for ABG sampling because it's easy accessibility and superficial nature and has excellent collateral blood supply from the ulnar artery. Question number 79, which of the following clinical manifestation of type 2 diabetes occur if glucose level are very high? Option A, hyperactivity, option B, blurred vision, option C, oliguria, and option D, increased energy level. So option B, blurred vision is correct answer because this one your sign of the hyperglycemia. Apart from this, some other sign or symptoms are increased thirst, tiredness, blurred vision, excessive hunger, urge to urinate large amount than usual. Question number 80. A client is receiving the long-term treatment with high dose of corticosteroids. So which of the following would the nurse expect the client to exhibit? Option A, weight loss, option B, pale thick skin, option C, hypotension, and option D, moon face. So option D, moon face is correct answer. So let's discuss some other side effect of long-term uses of corticosteroids. Weight gain, mood swings, increased blood sugar level, high blood pressure, osteoporosis, moon face, buffalo hump, and increased infection risk.